welcome everyone for coming tonight. It's so great to see a lot of familiar faces and some new faces here tonight. And also thank you to those who are following us online on Facebook and YouTube. My name is Deb Angus. I'm the founder of this group. I'm a 19-year survivor of traumatic brain injury. Basically, I was rear-ended at a red light, whiplash and concussion, and my life has never been the same since. So over a 10-year period, I wrote research, and this book came out in 2014. And it is available at the Calgary Public Library. It is available for sale here at our meetings, and it is also available at a few places here in Calgary. You can find out more about that on the website. And so tonight we have a guest speaker. Her name is Val Kowal. Kowal. I'm terribly sorry because I've been pronouncing her name incorrectly for many years, and it wasn't until we met to do these meetings I said, oh, I didn't know that. So she's here to talk to us about the HPA Axis, and this is the second part of the three-part series that she's doing. The first part she did in November, and that was what is the HPA Axis? That's the Hypothalamic-Pituitary-Adrenal axis. And so this explains how our body reacts when we have any kind of trauma and stress and that type of stuff happening. And Val was the acupuncturist I was working with, or she was working on me in 2010, 2011, and I was dealing with trigeminal neuralgia, which is excruciating nerve pain on the left side of my face, which was aggravated by chemical synthetic fragrance products like perfumes and colognes. And whatever she did in acupuncture was the only thing that helped calm that pain down. And so her and I just reconnected recently, and I said, hey, are you interested in doing some talks with our group? And she's just so happy to come here and talk to us, so we're very honored. So thank you very much, everyone, and please welcome Val.
If you have questions as I'm going through the presentation, interrupt, okay? Better than waiting till the end because you're kind of in that moment, okay? So don't hesitate on doing that. Today we're going to talk about disrupting the HPA axis. Before we get there, I hope I got the right one. Here we go. So a review from the last time, for those of you who weren't here, what is the HPA axis? It's your central stress response system. It is activated every time you experience stress or trauma. And as you'll see as we go through the presentation, the stress can come from pretty much anywhere, okay? It involves the hypothalamus and pituitary glands. Those are in the brain. And then the adrenal glands, they sit on top of the kidneys. And so it is a connection between the endocrine system and the nervous system, or the neuroendocrine system. It regulates many body processes. Stress response is obvious. Emotions and mood, metabolism, energy levels, your digestive system. So when you feel stressed and your digestive system feels very upset, that's because of your HPA axis. Sexuality as well, and your immune system. A lot of people who are very stressed out tend to be very susceptible to colds and flus. Stress is at the root of many chronic illnesses, and this connection is one of those reasons. Also from last time, stress and trauma both affect the HPA axis. Stress and trauma are different. Okay? Stress really is just living. Our society is stress. Trauma, though, is it's an more extreme response to stress. It tends to override or tends to exceed your body's ability to cope. Okay? About 75 to 90% of primary care physician visits are due to stress. Okay, so at the root of many chronic illnesses we see today, depression, anxiety, digestive disorders, immune system disorders, cancer, and such, stress is at the root. So understanding the HPA axis and working with it are absolutely critical for our health. Traumatic experiences are always stressful, but stressors aren't always traumatic. A lot of it has to do with our interpretation too. Okay? Both stress and trauma, though, will activate your HPA axis. This is hard to see on the blurry screen. If it's problematic, let me know. The stress response, basically, the hypothalamus and pituitary gland signal your adrenal glands to secrete cortisol. Cortisol is a hormone. It's your stress hormone. It's essential for life. Without cortisol, you don't do very well, okay? There are very few conditions that actually lead to loss of cortisol. And in fact, a lot of stress response creates excess of cortisol. And excessive cortisol can create a lot of problems in our systems. And it depends where you are, and in the next presentation, we'll get into the stages of HPA axis dysfunction, because we do see how the cortisol varies with these various stages. But essentially, the cortisol is released. It causes a release of increase in blood sugar to give you that energy for fight or flight. And it doesn't matter what the stressor is. If a lion is chasing you, or if your phone bill comes in and you realize your bank account is empty, your stress response is the same. Okay? The body does not distinguish from source of stress. It's a stressor, it's going to react the same. So today we're talking about disrupting the HPA axis. So when we're in a state of chronic stress or persistent stress, that HPA axis is constantly being activated, okay? And over time what it leads to is a loss of resilience. We become less capable of coping. It also depletes our metabolic reserve. And so what is resilience? It's the immediate capacity of our body to respond to stress. We become primed for it. Okay, so if you have been repeatedly stressed over and over again, your reaction is just like that. You don't have that build-up level. It's just bang, you're there. Zero to angry in 2 seconds. Okay? Metabolic reserve is your body's long-term capacity to handle that stress or trauma. And over time, that breaks down. And so instead of fight or flight, what we often see in these people is freeze. So, like the possum, you just collapse. Okay? Loss of resilience and depletion of metabolic reserve, it occurs through chronic activation of stress. And in our society, we generally don't get relief from stress. Work stress, lifestyle stress, dietary stress, family stress, financial stress, political stress, everywhere there's stress.
Neighbor stress.
Yeah, for some people too. Environmental stress. So what we see with persistent activation, we see changes in cortisol output. So your body starts producing more cortisol. But eventually what happens is your hypothalamus and pituitary is like, adrenals panicking again. You know, I mean, let's just not listen to him. It's like the boy who cried wolf. And we become more resistant to the effects of cortisol in terms of the stress reaction. We see disturbances in the diurnal rhythm or timely rhythm or body clock rhythm of secretion of cortisol. So you wake up in the morning dead tired. Oh my God, I can't get out of bed. You're measured and your cortisol is low in the morning. But at night, you're wide awake and wired because your cortisol is increased. There's been a reversal. And there's been quite a bit of research coming out lately on circadian rhythms.
Yes.
And the findings on circadian rhythms are essential. And what happens is a dysregulation from the central body clock to the body clocks for all the organs of the body. And in Chinese medicine, there is something called the diurnal flow of qi. And so each 2-hour segment during the day, the qi is maximum, or the energy is maximum in a particular organ and meridian system. And it ties in with all the research coming up now about body clock and circadian rhythm. We also see changes in the production of other hormones and neurotransmitters. When we look at somebody who is very chronically stressed, we often see in males low testosterone. Okay? The production of cortisone or cortisol and the production of testosterone have the same precursors. So when we're under constant stress, what happens is the cortisol is being preferred as opposed to the sexual hormones. If you look out in the wild, you know, that gazelle being chased by a lion, the last thing he's thinking about is reproduction, right? And it's the same thing with humans. Also, with neurotransmitters, we often see a reduction in serotonin. Then we see often depression in people who are under constant stress. And this is one of the reasons, because serotonin is a calming neurotransmitter. And so when you don't have enough of it, or your body's unable to use it properly, then we see depression and anxiety. So HPA axis disruption is not adrenal fatigue, as we tend to call it. It's a disruption in the HPA axis. The adrenals rarely show, there's no science really that shows that the adrenals become tired or that the adrenals themselves are unhealthy and secrete less cortisol. The regulation of cortisol release and of manufacture actually comes from the brain, not from the adrenals. So it's really, a physical functioning of the brain. So HPA axis dysfunction, it's a syndrome, okay? So it's a multitude and a constellation of a variety of symptoms, seemingly unrelated because it affects everything. And it's characterized by our incompatibility. Our bodies are not compatible with the way we live our lives. We're not meant to have a constantly activated HPA axis. So all modern stressors will impact the HPA axis, and it affects everything. It is said that stress is at the root of about 70% of chronic illness. I'd say it's probably quite a bit higher than that.
That's what I say here a lot. I can't stress enough how bad stress is.
Yeah, exactly. It is very bad. And when we're dealing with chronic stress, sitting and meditating is one element of dealing with it, but it requires a multi-pronged approach to deal with it. Sorry about this is a little small. So what are your symptoms? Well, we see a disrupted circadian rhythm. You wake up, you're wired and tired. You wake up very tired, you crash in the afternoon. I went through that myself, and panic attacks were very common with that. Cognition, brain fog, memory issues. Food sensitivity issues, so digestive issues. When you have a lot of cortisol in your system, your digestive system speeds up, so you may get diarrhea. And then it crashes, and then you're constipated. Endocrine system. Thyroid disorders are absolutely connected to your HPA axis. Did anybody hear thyroid? Know lots of people with thyroid?
Don't have one.
Oh, okay, yeah, that'll do it too. But other hormonal issues, estrogen dominance. So excess of estrogen in the system. Estrogen dominance is one of the things that plays a role in breast cancer, in men and women. Low testosterone. So there's quite a few different things that play into that. Energy. You're crashing in the afternoon and by 7 p.m., you're fit to be tied. You're running around, energetic. You get those peaks and valleys as opposed to a nice even stream of energy. And it's hard to relax even though you're exhausted. Exercise. You might be able to do 5 minutes. And then you burn. And then your recovery from exercise is very difficult. The pain, the inflammation, all of that is part of that. Immune function, increased allergies. How many people have gotten allergies after their brain injury that they never had before? Or food sensitivities. You used to be able to have dairy and suddenly you can't anymore. Low resistance. You catch cold or flu just by thinking about it. Okay? And then it can go on the other side of things, where your immune system starts attacking your healthy tissues, autoimmunity. Okay? Metabolism, weight gain, particularly around the middle. Cortisol loves to put weight around the abdomen. That's its favorite place. And then you'll see changes in things like blood sugar and liver function and such. Mood and emotions, depression, mood swings, highs to lows, deep, deep, dark depressions. Okay. Sexual function, low or no libido. Very, very common. Erectile dysfunction, very common. Again, those hormones, those precursors are being pushed toward the cortisol or stress side as opposed to the sexual hormone side. In women, hair loss is very common with a disrupted HPA axis. And it can be one of the most horrifying things for women, that suddenly this beautiful full head of hair is half of what it was. So we're looking at causes of HPA dysfunction. The first one, and it's very common in this kind of group, is physical injury. Okay? And when we're looking at physical injury for the HPA axis, though any kind of physical injury can disrupt the HPA axis, one very important one in relation particularly to car accidents and such is injury to the sphenoid bone. The sphenoid bone is the keystone of the body. It is, in acupuncture, it's actually a mirror of the pelvis. And oftentimes I treat people with back pain by adjusting their sphenoid. And it works, especially sacroiliac. It works very, very well. But it's also very effective for TMJ and jaw pain. The sphenoid bone makes up a large portion of the base of the skull, and there's a little compartment inside the sphenoid bone called the sala turcica, and that houses the pituitary gland. Injuries are often associated with high energy or high impact, so motor vehicle accidents, blast injuries in the military. There was recently, I think 30 or 35 U.S. soldiers in Afghanistan all developed a traumatic brain injury after a blast. 50?
The numbers kept going up.
It keeps going up? Yeah, it's sad. And so what happens with a sphenoid bone injury? Headaches and migraines. And I use this a lot to treat headaches and migraines, the sphenoid bone adjustments. Visual disturbances, pain in the eyes. It's not an uncommon thing to see somebody after an accident complaining of eye issues or visual issues. Trigeminal nerve issues, which Deb knows very well. And we actually did work on her sphenoid, even though I didn't tell her. Hormonal imbalances. Your pituitary gland is the master gland. It releases all these releasing hormones that tell your other endocrine hormones to release, or other endocrine organs to release other hormones. So if you have an injured pituitary or a misaligned sphenoid bone or a displaced sphenoid bone or even a fractured sphenoid bone, hormone imbalances are very common. We got trigeminal nerve issues twice, just for that.
That's how important it is.
Allergies. Again, because it's overactivation. When the HPA axis is dysfunctional, the immune system becomes dysfunctional. They're very connected. Asthma. Sinus issues. Okay, part of your sinuses are in the sphenoid bone. Dental problems, so TMJ, grinding teeth, clenching teeth. Even just the emotional stress associated with that. Psychological disturbances, depression, anxiety, personality changes. And it's strange how it affects personality, but it does. They actually, the degree of injury to the sphenoid bone is actually used as a prognostic indicator whether somebody will survive an accident or not. To look at that. Wow. Impaired cognitive function. So you can sit there watching TV and wonder what the show was about, and it's over, right? You can be reading a book and you just can't focus on it. You can't remember things. You can't focus on things. That brain fog, right? Surprisingly, upper abdominal issues. The transverse colon actually runs across the upper abdomen. So it connects to the digestive system as well. Neck and back problems, base of the skull. Sphenoid bone is part of that, but the sphenoid is the mirror of the pelvis. So if the sphenoid bone is out, then we're seeing issues with the lower back and sacroiliac and the hips. Sleep problems, insomnia, melatonin secretion, all of those begin to change. Pretty crazy for one bone, right? The next thing that can disrupt the HPA axis, and this is probably the most common thing in our world today, is psychological stress and trauma. Psychological stress is a very pervasive, it's constant, okay? It's persistent, it never stops. And we don't really realize how much it's affecting us. It's very insidious. It's chronic and long-standing very often. Rarely do you have one psychological stress and then it never happens again. If it's not the phone bill, you know it's the fire alarm going off, or it's a problem with your car, or it's an issue with the kids, or whatever, okay? Domestic violence is actually very commonly connected to this as well. Repeated psychological stresses, they have a cumulative negative effect. So we see this in children who've grown up in abusive situations. Their cortisol is higher on average than their peers who haven't gone through any kind of abuse or neglect. There is a significant overlap in brain changes, physical brain changes that are seen in PTSD and traumatic brain injury. So psychological stress has a physical effect on the brain and causes physical changes in the brain. This one was really interesting, and it was a fascinating study I came across, the gut-brain axis. There is major communication between the gut and the brain. In fact, the gut is actually considered the second brain. So this two-way interaction between the gut and the brain, it can actually worsen the initial brain injury. So if, like for instance, if you've had a car accident or you have fallen and such, and you may feel fine, but 2 weeks later, suddenly your symptoms starts to change. This is what it's often related to. So the gut-brain axis, it actually forms a secondary mechanism for brain injuries. And it can continue for months or years after the initial brain injury.
I believe it was Dr. Haxton who was here presenting to us, and he had mentioned that in the research he came across as well too, this is so important, and that they found within 4 hours after an injury, already that gut-brain axis is already
What the study shows is that somebody who has had a brain injury has have 12 times they have 12 times the risk of dying from an infection within 72 hours of the injury.
Wow.
Okay?
Can you repeat that?
Within 72 hours of a brain injury, that person has 12 times the chance of dying from an infection. Okay? Where does the infection come from?
Gut.
Yes. So what happens, and this was actually really quite a beautiful study, it was done in mice, and it was absolutely fascinating. I spent a whole afternoon reading it. They created an injury in the brains of these mice. And what they found was 28 days later, they saw long-term permanent changes in the large intestine.
Mm-hmm.
The large intestine became leaky. So the bacteria that normally and healthfully inhabit the large intestine actually can enter into the bloodstream.
Wow.
And what it does is actually create injury in the brain. Further to that, in this study, in the brain there's something called astroglial cells. Okay, these are supportive structures for the neurons. In the gut, there's something called enteric glial cells. Both are activated as a result of a brain injury. So not only are these cells activated in the brain, the gut component is activated as well. And through this process, there are actually epigenetic changes that result in lower expression of proteins that cement the cells together to create an intact barrier in the intestine. So when that's disrupted, what happens, or there's less of that protein that binds these cells together, it creates a leaky large intestine. Okay? You have a lot of bacteria in your large intestine. You don't want that getting into your bloodstream or into your brain. And so what they have found is that because of that, the area of injury in the brain actually increases. Okay? That form of endotoxemia. Very, very interesting. So whenever there's a brain injury, it's essential to work and heal the gut. It's essential. Inflammation. So infections can create inflammation. Inflammation is a stressor anywhere in the body. And a disrupted HPA axis can actually make it worse because stress hormones increase inflammation because they're trying to quench the heat, quench the fire. Causes of inflammation. Autoimmunity. Every autoimmune disorder has a disrupted HPA axis. And oftentimes a disrupted gut barrier as well. Blood sugar imbalances, diabetes. I've treated many people with chronic pain. I treat blood sugar and their pain dissipates. Chronic illness, hormone imbalances, infections. So infections, whether it's coming from inside the body or outside the body. So the gut issues that occur as a result of brain injury will also precipitate inflammation. It's genetics and epigenetics. Epigenetics is actually a really fascinating area. Stress hormones will actually change your epigenome. It'll change how your genes are expressed, whether they're upregulated or downregulated. They'll turn off genes, they'll turn on genes. And so the gut study, the gut axis study, basically what they showed is that it wasn't inflammation that changed the large intestine. It was epigenetic change. Okay? And these epigenetic changes are cumulative, and they're also inherited, but they're reversible. So if you were born of a mother, for instance, who was under tremendous stress, your epigenetics are going to show that. But you can change that. Okay? And this is speculated to be one of the reasons why children who have undergone abuse or somebody with post-traumatic stress disorder and things like that show higher baselines of cortisol than people who haven't gone through it. Does that make sense? So summary, what causes HPA axis dysfunction? Physical injury, very obviously. Psychological trauma, those are the two biggies. But today, one of the biggest ones is gut-brain axis dysfunction. We have a lot of gut issues, and we have, what is it now, over 150 identified autoimmune disorders in our society. All of them have gut issues at their base, all of them, and HPA axis dysfunction. Inflammation, all chronic illness, pretty much has inflammation. And in fact, what they're finding for Alzheimer's is that the toxicity of the amyloid plaques will actually disrupt the HPA axis. And it's the cumulative disruption or progressive disruption of the HPA axis that is a significant part of Alzheimer's. And so genetics and epigenetics, all of these things will affect genetics and epigenetics. Lifestyle, diet, stress levels.
Huge, yeah.
It's massive.
Yeah.
And so that takes us to the end of the presentation today. This was a hard one to keep down, but I did well.
You did
25 minutes.
Yeah.
I did really well. It's a very fascinating area, and it's one that's very often neglected. And within each of those components are many other things that can cause or disrupt the HPA axis. And there are many things that will predispose one to disrupting the HPA axis. For instance, if you're under a lot of stress at the time that you're injured, or if you've had previous traumas prior to the time that you're injured, or you've experienced a stressful event, all of that will predispose you to a greater chance of having a disrupted HPA axis. The other really interesting thing is if you are female, you are more likely to have emotional issues as a result of disrupted HPA axis, and it ties in with estrogen, which is really fascinating.
So now what does this mean then for people, like we're always saying there's about 80% of the population are walking around with brain injuries and aren't aware of it.
Yep.
So what is this implying for all of them? They have all these health issues and aren't aware that it's all connected to that.
Well, I think what happens is we tend to look at where the symptoms are.
Yeah.
You know, I have a sore back. But we don't look at, gee, what might be causing
Yeah, they
that
don't
sore
look at
back?
the root cause, they just give you a
Exactly,
pill.
exactly. And that's one area that Chinese medicine is well known for, because we don't dissect out. We don't have a cardiovascular system in Chinese medicine. We don't have a nervous system. The body is an integrated whole. So one part is connected to another part, which is connected to another part. There is no distinguishing. Also, physical body and emotions are part of the same spectrum. They're not separated, so emotions don't occur separate from the body. They're part of it. And this is one of the reasons, if we look at depression, a lot of people with depression actually have physical pain. Why? You know, so we need to look at the body as an entire system, as opposed to just separate physical components. Yeah. And you do see a little more with functional medicine and things like that too.
Yeah.
But they still dissect it out a lot, right?
Yeah.
You know, so, but it's a start.
I would say that's key. You need to look at the holistic
Yeah,
thing.
the whole thing. And so, you know, why are you sad? Your sadness may actually come from the imbalance from the physical injury. It may not be that you are depressed because you're depressed, or it may come from the trauma of loss. You know, or your physical pain may be connected to the loss of a loved one.
And the common story I hear a lot is people are diagnosed with depression and anxiety and given pills,
Yep, they are.
and not realizing that they have that because of all these other issues that are going on.
So when you look at root causes, you've got to look at the deepest possible level. This is the most rudimentary system, the HPA axis, and not rudimentary, but this is central to everything. Cortisol affects everything.
It also thins your bones.
Oh yeah, well, it's part of metabolism, catabolism, right?
Yeah.
And so, so when you're dealing with your own injury or the injuries of a loved one or the difficulties of a loved one, looking at the context of it, going like, I mean, when I looked at mine, I took mine right back to childhood as a root cause. I was dying as a child, and so when you have to face those things as a child, those are extremely traumatic. And you carried all of those traumas with you through life. In Chinese face reading, it's very interesting. They'll look at the ears and the face. Every experience in your life shows there. Where a line occurs. We'll show. It doesn't diminish beauty at all. But for instance, where a line occurs on the forehead will show an age where a trauma occurred.
Wow.
You know, or, you know, and in childhood trauma, it shows on the ears a little more. It's actually really fascinating, but your body shows you all of that. And the body, but even if your body's out of balance, you may not feel it, but there are points in the body that we can just touch and see that, oh, wait a minute, this is happening in your body, even though you might not have the symptoms yet. It tells us a lot of things that's going on. We don't have to be mentally aware of it or consciously aware of it. It's pretty fascinating. Yeah. So when we're looking at HPA axis dysfunction, don't discount that there might be a central cause or a central root to it. You know, sure, treat the symptoms, but go deeper than that. Otherwise, you're on medications the rest of your life, right?
Brings me to my question. How do you interrupt this vicious cycle? Like the physiological manifestation of psychological issues, which then, because you're sick, the brain goes. And because your brain goes, you're sick. It's like that old commercial, I can't get a job because I have no experience. I have no experience because I can't. How do we stick a spoke in that wheel and change it?
There is a process. Sorry, go ahead. You were saying something.
You're asking how do you disrupt it, right?
Like, how
How do you rebalance it?
Right?
Yes,
Like,
how do you rebalance it? That's part 3.
Part 3.
However, I'll give you a primer, okay? One of the things that I have learned, and I've been practicing acupuncture and Chinese medicine, it'll be 15 years since I graduated this year, which is really hard to believe because I feel like I've just scratched off the tip of the iceberg. But one of the things I have found, and I've worked with a lot of very chronically ill, very seriously ill people, autoimmunity, cancer, all of these people have HPA axis. And when I first started it, I didn't know about this HPA axis. I started learning it through my own autoimmunity, okay? And understanding, the lifestyle choices that come with aggravating the HPA axis, so starting to change those is the beginning. But working on those internal systems with somebody who understands them, who's not just going to give you a Band-Aid that, oh, you're depressed, or you have pain, so let's just treat that. Those experiences, that imbalance, is manifested through your entire meridian system in acupuncture. And so we work on rebalancing those, okay? Nourishing what needs to be nourished and sedating or balancing what needs to be sedated and balanced. But every time, every day, you're different. And so it's understanding why your body's showing you these things. And your body does show you these things. It's learning to understand that message, okay? So things like essential oils can be helpful. Okay, you know, we can piece together all these things. So acupuncture, essential oils, diet therapy, chiropractic, craniosacral, I mean, all of these, we can piece together each of them. But if they're not integrated into a system, if they're not addressing the root issues, then you're going to stay in that cycle.
And that's where my concern is, because we're all going willy-nilly, trying this, trying that. There's not a central system that says, oh, we have to look at this holistically, and we have to make sure that everything is in balance. We don't have that here in Alberta.
Well, we
And
don't
we're-
have that in the
we're left-
medical system
Yeah,
today.
we're left on our own and say, oh, we
Yeah.
heard this works for other people.
Yeah.
Oh, we heard that works.
Well, this is why I wanted to do this presentation.
Yeah,
And when
this is
Deborah
why this
asked
is
me to
so
do this
important.
whole thing
Yeah.
in one 20-minute session, I was like, are you kidding? Doesn't work that
That's why we have to
way.
break it up in 3 parts, and it's even
Yeah.
tough that.
And even that is really tough. And that's, I mean, I mentioned this to Deborah
Yeah.
today, I'm doing a 6-hour session starting in March. It's in 2-hour segments. That goes into far greater detail than this. So when we do get into those treatments.
That would be where?
It'll be actually in the boardroom at my office, which is in Varsity Estates. Yeah. So, and I've mentioned to Deb, if there are people in this group, you want to kind of come together, I can do a special session for just this group. Okay, so, but you talk to Deb about it, and if there's interest, then we'll set one up specially for
Yeah.
you guys.
Just send me a PM or email or whatever and say
Yeah.
you're interested. I think it was sometime in April you were thinking?
Yeah, we can set it up for April.
Yeah.
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 And, but, I mean, I've been through depression
Or let
myself.
me know today, I can put you on a
Yeah.
list, yeah.
Yeah, I've been through depression myself. I've gone through significant HPA Axis dysfunction, and I was fine until I hit my 20s, and then bang, it hit, clinical depression. I was put on antidepressants, I hallucinated, I was suicidal. It was the worst time of my life, but also the best time, because I wouldn't be doing what I'm doing now without that experience. And I wouldn't have the knowledge I have now without that experience, okay? So when we look at how do you get out of that cycle, you have to be patient. It takes time. It took you time to get to where you're at. It's not going to change overnight. So you need to be patient. Allow yourself whatever you're feeling. Acknowledge that. That is part of who you are right now. Own it. Okay? Don't feel bad. Don't feel depressed about it or bad about yourself.
Or I
Like, oh my
shouldn't be
God,
doing
why do I
this, or I
feel this
shouldn't
way?
be
I
doing
shouldn't
that.
be feeling this
Yeah.
way. You feel the way you feel because that is just where you are.
That's your
And it is
reality.
okay.
Yeah.
It is okay. It will get better.
Mm-hmm.
Yeah. It will. Does that make sense?
Oh, yes, this is awesome. Thank you
Yeah.
so much.
You're welcome. And as I said, all this stuff I've been through. Even just a few years ago, I was having panic attacks coming home from work if I had patients after 3 o'clock because I'd crash at 3. And I'd be panicking coming home, not knowing if I'd make it home. And I would have to tell myself each step from the train station, one more step, one more step, one more step. And I'd get home and collapse for 4 hours. Yeah. And then I'd wake up in the morning, exhausted, and do it all over again. Yeah. So I absolutely
So
understand.
what's one thing, one item we can start tomorrow that would help get us rolling?
Actually, one of the best things, believe it or not, actually, I'll give you 3. 3 is a good one. So I'll give you 3. First one, salt water in the morning.
Yeah.
Good quality salt, not Windsor Sifto. I use Redmond's real salt. Okay? Sorry?
For gargling?
Nope. So there's 2 ways you can do it. You can either take a pinch and put it in water first thing in the morning. Okay? You can even add lemon to it. Almost make it like a tequila. Or you can do something called Soleil water, where you take a pint jar and fill it about 1/3 full of salt and let it sit overnight with water over it. If the salt is completely dissolved, then you add more salt to it. You want salt stuck on the bottom because then the water is saturated with the salt. And it's ionized.
Sorry, can you spell that word that you just said?
Soleil?
Yeah,
Soleil, S-O-L-E,
okay.
as in ole with an S.
Sorry.
That's okay, don't apologize.
So it's just like a cup with...
Yeah, and then you, because you want the water saturated, okay? And so what you do is you take a tablespoon in the morning, but do not touch it with metal because it'll de-ionize it. Use plastic, ceramic. I use a little mini silicone muffin container or a little muffin tin, and I'll scoop it and put it in a glass, and I add half a lemon and hot water to it, and I drink it first thing
So
in
I
the
can't do that because I'm on low sodium stuff.
Yeah, there's other things for you.
Okay.
You take that once a day in the morning. It would be contraindicated in high blood pressure situations.
Yes.
Okay? If you know, or if you retain a lot of water from salt, sometimes it is a sodium deficiency that causes you to retain water as well. But salt is the flavor that goes to the kidneys in Chinese medicine, and the adrenals are part of the kidney system, and so is the brain. Okay? The brain is called the sea of marrow. Okay? Marrow derives from the kidney. Okay? So that first thing in the morning is very good for your adrenals. Okay?
Just 1 teaspoon?
Tablespoon.
Tablespoon.
But start with a teaspoon if you want.
Yeah.
Okay? Number 2. Bone broth. The gut-brain axis is essential for dealing with brain injuries, and one of the best things to have to heal your gut is bone broth.
Is there an alternative? You don't eat meat?
No.
Her and I had that discussion already.
The reason why I say that, and I don't mean to be really blunt about it,
Yeah.
it's the collagen you want. And plants do not make collagen. I was vegetarian for 17 years, and then I was diagnosed with autoimmunity. I can't eat anything other than fresh fruits and vegetables that I ate as a vegetarian because they're all inflammatory for me. Okay? So it's very hard if you have fish. Do you have fish in your diet?
Oh yeah, like the thought of bone broth makes me want to vomit.
You can do a fish broth.
Sorry.
You can do a fish broth.
Okay.
Okay. The only other contraindication with the bone broth would be is if you had cancer. If you have a history of cancer, do a meat broth. Cook it for no more than 4 hours. Okay. One of the amino acids increased quite a bit in bone broth, and what that does, it's almost like giving sugar to a cancer cell. Okay. So if you've had cancer, then go with the meat broth and cook it for no more than 4 hours. Okay. The other thing I would recommend is lavender essential oil.
Yay!
Lavender is very calming. You can use things like Boswellia sacra as well, which is a form of frankincense. It's very calming for the mind, and I often mix it with my lavender and put it in a diffuser. Okay? If you don't like smells, because some people have issues with smells and things like that, you could do candles, you could do Epsom salt baths.
Yes.
Salt baths, even soak your feet in salt water. Kidney meridian starts at the bottom of the feet. It's the lowest point on the body. Soaking your feet in salt is another way of nourishing your adrenals. And the points on the bottom of the foot actually go straight up into the lower abdomen of your adrenals. So there's 4. So we're going to get more into this in part 3. And we will look at all of those things that we looked at as causes of how do you deal with things. So how do you deal with a sphenoid bone injury? What are your options? You know, how do we deal with that gut-brain axis? How do we deal with the psychological trauma? How do we start moving through that and then rebalancing things?
Do we have you guys' permission to go for an hour on that one?
It's a fascinating topic. Trust me, I had a hard time keeping it down. You know, I could have did 50 slides, easy. So interesting, right? But there is a way, there's a path forward, and that's something you have to remember, is there's always hope, okay? You are not stuck in this forever. It's just a final way. You might need a machete on the path, but there's a path in the past, right? Any other questions? We all good? Everybody understands?
Okay. Well,
Feeling motivated?
yeah.
Awesome.
Thank you very much, Val. Here's
You're
a little
welcome.
thank you gift for you.
Ah,
We appreciate you coming, and we're looking forward to your next talk. Thank you very much. And I'm now going to turn the camera off as we get into our sharing circle.